I graduated and worked as a quantity surveyor for about 10 years. So I was working in the construction environment, and during my time working there I was given the opportunity to undertake health and safety audits, and did my NEBOSH qualifications to enable me to do those audits, and got an interest in health and safety generally. Then about 8 or 9 years ago we were relocating from Manchester up to Leeds, and I actually got an opportunity with a previous employer to become purely a health and safety consultant. And at the time I decided that quantity surveying wasn't quite for me, and that I'd like to make a difference in the health and safety in construction rather than the cost and the money in construction. So that happened, and I've been in health and safety for about 8 years. My primary function at Callidus is the CDM coordination side of what we deliver. So I'll sit on a design team for a proposed construction project, and help to coordinate and communicate between all the members of the team on health and safety issues, and on policing the design development to make sure that the designers are taking into consideration health and safety issues revolving around both constructing the building and its ongoing maintenance afterwards. And we just give advice or highlight where we think there might be flaws that need looking at closer. So that's the CDM perspective. From the IT perspective, I'm assisting with the management of the COSH database for one of our key clients, which in essence is a log of all the substances that are hazardous to health that are being used by the contractors and facilities, cleaners, etc. within their store operations, just so they're aware of what's being used on any one site at any given time, and that to show that the contractors themselves are actually complying with the COSH regulations that are put on them, having the right controls in place to protect their operatives and the staff and the shoppers that are within the store, the general public. I think the most challenging part of working in health and safety is breaking the reputation that health and safety consultants have. We're not there to cause trouble, but that seems to be the impression a lot of people have. We're there to help them to make things better, to improve standards of health and safety. And I think that's the most challenging one, is getting that argument across that we're not there to be awkward, we're not there to make their lives difficult, we're actually there to make it easier. And if they consider the right things at the right time from the start of a project, or from bringing in a new policy or whatever it may be, we can assist them early doors and make it a far easier and far smoother process. Construction's an exciting industry if it's what floats your boat. I mean, to see huge tower cranes take over the skyline of a city centre, or to see a really flamboyant piece of design come into being from paper through to actually being physically built and populated and functioning. The projects that you get involved in, I mean, they change our landscape, they change our lives. There's significant strides going ahead at the moment in changing and rationalising all of the health and safety legislation. We're yet to see exactly where that goes and what it brings and how it will change both the way we deliver our services and what's required of the clients themselves in the future going forward. And I think we have to meet that head on and be up to date and up to speed with what is happening, so that we can still give sound and valid advice to the clients. I think from the client's perspective, I think they're going to be expecting a lot more of health and safety consultants. I think they're going to rely on us to advise them properly and to make sure that they comply with whatever is required of them when all these changes become implemented. I think there's some very exciting times lying ahead, and Callidus want to be at the forefront of that, future-proofing both ourselves and our client organisations.